Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Aiims Norcet previously related question answer. Part 3. Let's start. The first question. During CPR on an adult, what is the recommended depth of chest compressions? Option A, at least 2 inches 5 centimeter. Option B, exactly 3 inches. Option C, 4 inches. Option D, 1 to 1.5 inches. The correct option is option A, at least 2 inches 5 centimeter. In a child with epiglottitis, which position is usually preferred by the child to ease breathing? Option A, prone, lying on the stomach. Option B, Tendelberg, head lower than feet. Option C, tripod position, sitting upright and leaning forward. Option D, supine, lying on the back. The correct option is option C, tripod position, sitting upright and leaning forward. What is the recommended dose of adrenaline epinephrine used in pediatric emergencies such as cardiac arrest? Option A, 1 mg per kg body weight, 1 ml, 1:1000. Option B, 0.1 mg per kg body weight, 0.1 ml, 1:10,000. Option C, 0.012 to 0.03 mg per kg body weight, 0.1 to 0.3 ml per kg, 1:10,000. Option D, 0.5 mg per kg body weight, 0.1 ml per kg, 1:1000. The correct option is option C, 0.01 to 0.03 mg per kg body weight, 0.1 to 0.3 ml per kg, 1:10,000. How long effective copper T380A? Option A, 10 years. Option B, 5 years. Option C, 3 years. Option D, 15 years. The correct option is option A, 10 years. What is the approximate length of the umbilical cord at term? Option A, 20 to 30 centimeter. Option B, 50 to 60 centimeter. Option C, 70 to 80 centimeter. Option D, 90 to 100 centimeter. The correct option is option B, 50 to 60 centimeter. In myocardial infarction, chest pain that persists despite rest is due to option A, coronary artery spasm. Option B, myocardial necrosis. Option C, reflux esophagitis. Option D, unstable angina. The correct option is option B, myocardial necrosis. Using the rule of nines for an adult, what is the percentage assigned to the entire head and neck area, front and back? Option A, 4.5%. Option B, 9%. Option C, 18%. Option D, 1%. The correct option is option B, 9%. A lactating mother presents to the emergency department with carpopedal spasm. What should be the initial management step? Option A, calcium gluconate, bolus IV. Option B, magnesium sulfate, bolus IV. Option C, magnesium sulfate 10 ml IV over 10 minutes. Option D, calcium gluconate 10 ml IV over 10 minutes. The correct option is option D, calcium gluconate 10 ml IV over 10 minutes. A patient is prescribed digoxin 0.25 mg OD. Before administration, the nurse notes the apical pulse is 54 beats per minute. Which action should the nurse take? Option A, recheck the pulse after 30 minutes and then give the dose. Option B, administer the medication as prescribed. Option C, withhold the dose and notify the physician. Option D, administer half the dose and document the pulse. The correct option is option C, withhold the dose and notify the physician. Which of the following is a negative symptom of schizophrenia? Option A, anhedonia. Option B, disorganized speech. Option C, hallucination. Option D, delusions. The correct option is option A, anhedonia. A nurse is reviewing the ECG of a patient with low potassium hypokalemia. Which finding is most likely to be present? Option A, widen QRS complex. Option B, flattened T waves and visible U waves. Option C, tall peaked T waves. Option D, shortened PR interval. The correct option is option B, flattened T waves and visible U waves. What is the primary reason for choosing the Z-track method when administering an intramuscular injection of iron dextran? Option A, to allow for a larger volume of fluid to be injected. Option B, to speed up the absorption of the drug. Option C, to prevent the medication from staining the skin. Option D, to reduce the risk of hitting a blood vessel. The correct option is option C, to prevent the medication from staining the skin. All of the following are examples of antipsychotic drugs except option A, clozapine, option B, alprazolam, option C, olanzapine, option D, quetiapine. The correct option is option B, alprazolam. A patient of lithium therapy serum lithium level should monitor after first dose of option A, 12 hours, option B, 24 hours, option C, 6 hours, option D, 48 hours. The correct option is option A, 12 hours. Which test is used for rapid test for dengue? Option A, NS1, option B, ELISA test, option C, IgM antibody test, option D, Widal test. The correct option is option A, NS1. The physician orders 500 ml of normal saline to be infused over 4 hours. The drop factor is 20 GTT per ml. What is the correct flow rate in drops per minute? GTT per minute. Option A, 32 GTT per minute. Option B, 21 GTT per minute. Option C, 42 GTT per minute. Option D, 50 GTT per minute. The correct option is option C, 42 GTT per minute. A nurse is caring for a patient with a suspected myocardial infarction. Which lab value is most specific for diagnosing cardiac muscle damage? Option A, alanine aminotransferase ALT. Option B, serum creatinine. Option C, white blood cell WBC count. Option D, troponin I or T. The correct option is option D, troponin I or T. A patient is scheduled for a pulmonary function test PFT. The nurse should instruct the patient to withhold which of the following prior to the test? Option A, antihypertensives. Option B, vitamins. Option C, bronchodilators. Option D, antibiotics. The correct option is option C, bronchodilators. Which of the following is the most common early sign of a pressure ulcer? Option A, skin that is broken and bleeding. Option B, non-balanceable erythema, redness. Option C, yellowish eschar on the wound bed. Option D, presence of a fluid-filled blister. The correct option is option B, non-balanceable erythema, redness. A patient is suffering from bradycardia, warm dry skin and hypotension. These symptoms are suggestive of neurogenic shock. What is another name for neurogenic shock? Option A, cardiogenic shock. Option B, distributive shock. Option C, septic shock. Option D, hypovolemic shock. The correct option is option B, distributive shock. Thank you for watching. Please like and subscribe.